It's a pleasure to have Dr. Johnson and Nick back with us. First of all, what are UV rays and what are the dangers of ultraviolet rays?
Well, first off, I also want to let you know we've got a trio here. Melissa Moore's here, but to answer your question, dangers of ultraviolet radiation, and both Nick and Melissa are exposed to a lot of patients that come in asking them these questions, so they'll kind of be contributing here. But in terms of the exam room, ultraviolet radiation comes in A, B, and C, and those different wavelengths can cause skin cancer, sunburns, damage to the eyes, and deeper tissues in our body. So most people don't know that. They may have heard of UV, but ultraviolet radiation is really what UV stands for. And the dangers of that is that it causes people over time to develop cataracts, which people are familiar with that term because they may think mama had that, or maybe mama's listening. And the other part of that is that it can cause macular disease, and that's loss of your central vision. Now, these are things that people cannot detect by the way they think they see, whether they wear glasses, whether they don't wear glasses, whether they wear sunglasses, or whether they don't wear sunglasses. Everybody has in their mind that their vision equals how they see with their glasses, and we love to tell them, is that when you buy a toothbrush? Those are some of the dangers, but the big thing that people don't realize, and it's hard to do, but from 0 to 18 years of age are when people are most exposed to damaging ultraviolet rays that then in future years causes these eye health potential loss of vision difficulties, one of which is cataracts, like we've mentioned, in macular degeneration, but also the big thing is skin cancer. So that's why you come in and, you ask all of us, based on occupations and what it is you like to do and, how much you're outside. A lot of people say, I'm never outside. Well, do you walk a dog or garden or cut the grass? Well, of course I do. Well, that's still outside. And whether it's cloudy or sunny, winter, spring, summer, fall, raking leaves, or cutting grass.
And people also have, issues such as dry eyes and allergy eyes that can be helped to be prevented by wearing protective sunwear as well. So that's another issue that can be helped, by wearing protective sunwear.
Of course, it seems like it's a good idea to wear sunglasses at any hour in which the sun is up, but are there any particular hours during the day in which UV rays are the strongest? Yeah,
just to backtrack just a little bit, most people think exactly what you just said, is that the sun has to be out, understandably because of sunglasses. But that's really, we kind of hate that because it's really a misnomer. You are exposed as much to ultraviolet radiation on cloudy days, winter, spring, summer, or fall, as you are on sunny days. And a lot of people just get them out wearing when they drive the car. But when they're outside, to answer your question, the hours that they're most exposed to damage is between 10 a.m. in the morning and 4 p.m. in the afternoon. Nick, Melissa, y'all might have something to contribute to that based on patients.
In addition to that, as Dr. Johnson was saying, 10 to 4, kind of the prime time during the day, especially this time of year when a lot of people are skiing, they're exposed to ultraviolet radiation reflecting off the snow, from really dawn to dusk, even into the evenings and stuff as well. I know snow reflects, up to 85% of UV rays. That's both UVA, UVB, and UVC. And a lot of times you'll see different ponds and things, on the ski slopes or water building up, and that's also reflecting light. So in addition to the highest times, 10 to 4, really all times throughout the day, even overcast days, especially on the ski slopes and stuff this time of year when there's a lot of snow and stuff.
And early in the morning and later in the evening, too, when the sun isn't as bright, you still need to have the protection from the ultraviolet rays because the ultraviolet rays are just as damaging at that time as they are, during those peak hours. Damage can occur.
In addition, to follow up what Melissa was saying, people driving to work, in the mornings and going home. A lot of people are either driving east into the sun or driving west home into the sun, direct light. You see people all the time putting their little visors down and kind of using their hands to reflect the light. And, there are a lot of times when you are exposed to those rays throughout the day.
What should people look for when they're picking out sunglasses, and certainly you all at Eyewear Gallery can give some pretty good advice about that.
I'm just going to say this, and I know Nick and Melissa, and talking to the patient, I examine the patients in the room and based on what they tell me, but we find they tell all of us different things. But consistently what we find is that only 40% of adults in the United States, 40% of adults in the United States don't wear sunglasses when they're outside. And again, I think there's this thing about, well, I don't need them, or I see okay, or they're not really thinking about the health aspect of that. And why is that? I think it's a lack of education. We need to be more informed via magazine vehicles, billboards. We have in our profession that type of information, but I think sometimes in our profession we're lacking in getting that information out. Sometimes you'll hear stuff that'll say, oh, this type of contacts, and the manufacturers control this information. They have UV blockage. Well, that is not the same as really protecting the inside of your eyes. But the biggest thing I think that people think in terms of what should they be looking for, I think the biggest thing people think is they're looking for a sticker on a pair of sunglasses that they might find at the gas station. They might find at some of your department stores. And they'll say, well, when they come in, I've got sunglasses and I got them. Well, they didn't cost a lot. They have that sticker, though, that says that they block UV. And again, back to something that we said earlier, any plastic lens, even if it's not tinted, is giving you just about as much ultraviolet protection. So the important thing is that they need to know that they need the help of a professional and not go to department stores and stuff like that, so they can really make sure they've got the appropriate lens for what they like to do. And that means color, that means the frame, the fit. It's not necessarily a name of a manufacturer. It can be if it's something they're really into, but we'll find something that makes it work. And we're not really just trying to promote ourselves here. We're really trying to let people know, because there's such a lack of knowledge in this regard. And ultraviolet rays are so damaging to our vision system. And sometimes we find a lot of people with certain medications or smokers, they're much more at risk from ultraviolet exposure. Again, we reference cloudy or sunny days, and they don't know about it.
Well, I think we usually recommend polarized lenses along with the ultraviolet protection. That's going to improve contrast and clarity, reduce eye strain, allow more perception of actual colors, as well as the different colors of lenses for different situations. Maybe a brown or an amber lens for a darker situations, or if they do trail riding or running or things like that, you may want a brighter colored lens, whereas if you're going to be in bright sunshine, you may want a darker gray colored lens, maybe with an iridium coating. We do recommend different lenses for different types of situations depending on what the patient is going to be using the lenses for.
In addition, Melissa was saying the lenses being the most important part for protection and also safety. There's a lot of studies that indicate that polarized lenses, while you're driving, especially when the roads are wet and light's reflecting off the roads, there's been studies that have shown that drivers can stop in emergency situations, significantly shorter, preventing accidents and thereby increasing their safety of themselves and others by wearing polarized lenses. But also the lenses have to fit, custom fit into a frame fit specifically for that individual. There's different, temple sizes, temple length, bridge, kind of where your nose is, and size of lenses that help protect against ultraviolet rays and sun as well. If you don't have a proper fit, then they're not going to function, for the individual. And, we see a lot of times people picking up stuff at a large retailer or Target or wherever. They are not fit properly. In addition to that, people need their prescription in their sunwear and their sunglasses so they can see, prescription, non-prescription, even in bifocals or no-line bifocals for individuals and patients. We find that people just don't know about. We'll see people that, had no idea they can get their prescription in their sunglasses, and they're just amazed because they've been, either kind of trying to wear them over top of their indoor pair,
or their readers underneath,
or their readers underneath,
the golf course,
and that's just not safe,
or necessary.
What about Eyewear Gallery? Of course, people have loved ones, and they're always concerned about their eyesight and their eye care. What about, here we are in the month of February, about loving somebody and giving them the gift of good eyesight or good eye care? Could you go into detail about that?
So we're going to start doing, for the month of February, kind of a Love Your Eyes campaign. So where people can sign up a loved one for a vision screening. We'll be doing those Fridays between 2 and 4 for the rest of the month of February.
And just make sure they call in
to
first,
schedule that.
so
exactly.
We've got that scheduled.
Our effort, of course, is to continue to increase education and awareness of eye health care issues, as well as ways that, people can protect their eyes and ultimately not outlive their sight. Especially here in Memphis, we really care about the community, and we are dedicated to, increasing education, protecting people's eyes, in addition to their overall health and well-being. It's something that we're really passionate about, and it's something that we really care about. So as Melissa was saying, Fridays from 2 to 4, you can give us a call, 901-763-2020. We can, of course, determine the need of that individual for the vision screening, someone that you love or someone that you care about. Ultimately, loving your eyes, and I love you, if you will, EYE.
They may still want chocolates and flowers, too,
We've got chocolate.
Yeah, we're not saying we don't want to get anybody in trouble, and they say, what do you mean an eye exam? That's not near as good as what I was expecting as a gift, or I like chocolate. A few roses thrown in might have been okay, too. So we're not saying to avoid that.
We also have really cute designer frames to dress up those polarized lenses, too. We could definitely help the fellas out in that department.
Yeah, in terms of guys, and that's usually the females are sending the guys in. They want to know, it's like, do you have Costas? Do you have Maui's? Do you have Ray-Ban? Do you have Oakley? Do you have Wally X? They're, Wayfarers in the Ray-Ban. The guys kind of know that. And so they want something functional when they're going out on the golf course or fishing or running, biking. And again, like Nick said, people don't know they come in their prescription, so they can't see their odometer, their riding, or their heart rate, maybe at the gym or just running. They just make do. We've been amazed because we are out in the community sponsoring a lot of these groups to educate them, and we find so many they can't see, but they just make do with just a pair of pickup sunglasses that I don't think they're really thinking of ultraviolet protection. I think they're just thinking that the sun's bright, let me just throw these on. Those are things the guys like Nick touched on. And then the ladies are different. They like the Chanels. They like, Tory Burch and Prada. And that's kind of what our niche is, to see it could be style. It could be function. But it really is, in the end, function. And they can dress it up however they want to, in whatever manufacturer, if they're into a certain name. But we carry a lot of handmade cut frames from European countries that are really, really customized. And we're one of the few in the country that customize these UV protective lenses, be it for sports or dress wear, casual. They don't have to be running. Anyway, so we're one of the few in the country that do this. And so we are proud of that. And we would like to continue to help people understand the fact that we've got our boomers now, and they're all into needing the bifocals, and there are people younger that are doing all of these other sports, but they're not thinking long term. They're only thinking grandma's old, so she's got these eye health problems. One day that may be me, but I don't need to worry about that because I'm not old. But they don't realize, like we said with kids, 0 to 18 years of age is when they're the most exposed to the damage that's going to show up in later years. May not be as far out as grandma at 80, but we are living longer, and because of that, one of the greatest sources of blindness for the population is going to be macular degeneration. Sometimes people will say, "Well, did that have to run in my family?" No, it didn't. And even if grandma had it, it may have been that she was out in the field a lot, or she was outside a lot, or she was tanning a lot by the pool, and so that the ultraviolet rays could have precipitated that macular degeneration. In addition to that, she could have had a gene for that. So, but none of us know that. The best thing is to have your eye health checked. Come and see your eye doctor. Make sure that we know how it is you're using your eyes. And when people have beginning cataracts, we found a lot of times if we can get them in some type of protective lens early enough, it can keep them from ever needing surgery. Because most of the time when people hear the word cataracts, oh my gosh, I got to get cataract surgery, I'm too young for that, or when will these be ripe? So, well, they may never be ripe, so to speak. We just want to let you know why it is we're telling you this. We can't force you to wear anything. We just want to give you the information. And that goes all back into the love that we're talking about for Valentine's Day. That's one additional gift that you can give your loved one or loved ones.
Finally, how can our listeners get in touch with Eyewear Gallery, whether that be by phone or whether that be by website, and where is Eyewear Gallery physically located?
We are located on the corner at Perkins Extended and Poplar, 428 Perkins Extended, Memphis, 38117. Our telephone number is 901-763-2020, easy to remember. Our website is www.eyeweargallery.com.
And make sure they know in that Eyewear Gallery, everybody, that it's EYEWEARGALLERY.com, because a lot of people think it's just the letter I.
Thank you so much. We've been speaking with Melissa Moore, Dr. Warren Johnson, and Nick Poveromo of the Eyewear Gallery here in Memphis. This is Eye on Vision.